We've got Dr. Bordet. Is that correct?
It's Bordet.
Bordet. All right. Dr. Bordet from Integra Healthcare in this morning. How are you? You're a dermatologist?
I am. I'm a dermatology consultant. Thank you for having me
Are
this
you
morning.
new to Ireland?
We just arrived 3 weeks ago.
Oh, wow.
Yeah.
Brand new. How long have you been in this field?
Dermatology, gosh, many years. I've been a consultant dermatologist in Cambridge in the UK for 15 years.
Okay.
And started my training in 1994. So long time ago.
You're not that old. Come on.
No, not that old.
You're like or you started when you were 12.
That's it.
Where did you move from?
From Cambridge. Yeah.
Okay.
So yeah, directly from the cold.
Right.
To the sunshine,
To
and
the
that was
sunshine.
the draw, and obviously Integra because it's a lovely place to work.
Yeah. Were you just like, I'm not getting enough patients here in Cambridge. It's I need to go to a sunny island where I need to focus on the skin.
Not at all. So I worked in the NHS, which is crazy busy, but I also had a private practice for over 10 years with a 3-month waiting list.
Wow.
Everybody thought I was crazy to close it down and come here, but I love the sun. I know I shouldn't. I'm a dermatologist, but I absolutely love the sun.
But you know what to do to protect yourself.
I do. I wear my SPF every day, which is why I don't look as old as I am.
Exactly. What SPF? I always like to ask this of dermatologists.
That's a really good question.
Yeah.
So I put SPF 50 because we always put a really thin layer and we don't get the actual 50. So when you're putting it on thinly, you're probably only getting 20, which is still better than nothing. But I wear mine in the winter in the UK because what people don't know is UVA levels are constant throughout the year.
Yeah.
And although it's UVB that gives you cancer more likely, UVA causes pigmentation and aging. It penetrates deeper into the skin where we have our collagen and elastin. It degrades those fibers and it gives you wrinkles and brown marks. So if you want to look younger, you need to wear your SPF every single day.
I need someone to I need someone to tell me that more.
So what do you think? What do you think's better, spraying it on or smearing it on?
It really doesn't matter.
Doesn't matter.
But what does matter is if you've got acne-prone skin, then you want to be choosing one that is non-comedogenic. That means it doesn't block the pores. Otherwise, it will be too greasy. So, yeah, I mean, if you come and see me, I'll tell you which SPF you need to be using.
But when you talk about a thin layer, can you put it on thicker with a spread, or is the spray what gives you a thin layer?
No, it's the amount you use.
Okay.
So it is the amount. And if you find children's SPF often is a physical block, so the substance in that is more visible, so we can see where we're putting it on, and that's why they look a bit white like a ghost.
Yeah.
Whereas the ones designed for adults are usually a chemical sunscreen, so you don't look white as a ghost. You don't know you're wearing them, and some are really light, fluid. Yeah. You can also get tinted ones, which often women like.
I have the tinted and for my face and everything, but I try to remember to do that and put it on my hands because if you're driving, your hands are in the sun.
Exactly.
I've heard this once, and let me know. Tell us if this is true or not, or a good way to look at it. But the number on the sunscreen, 15, 30, 50, whatever, equate that to minutes, and that's when you need to apply it again? In other words, after 15 minutes, you got to put SPF 15 back on again.
So
is that a good way to look at it, or no?
In a way, yes. I mean, I would always say don't use anything below 30 because there's not much of a difference between 30 and 50, but there's a huge difference between SPF 15 and 30. It's kind of an exponential.
Okay.
Would you say that that's good for about 30 minutes before you need to reapply?
Yeah, so the number relates to the UVB protection.
Okay.
And the UVB protection is the one that gives you burn and more likely to give you cancer. So if you have an SPF 30, that means if you spend 30 hours in the sun, it's like you've spent 1 hour. If you have SPF 50, if you spend 1 hour with it on, then it's like you've spent 50 less hours. Does that make sense?
Yeah.
So it's like, so in a way, what you're saying is right. You do need to be reapplying it more frequently, the lower the number.
Right.
But I would just go for a high factor, but always reapply if you're swimming or sweating because it will be coming off.
Yeah, that's the hardest with the kids, though. I mean, that's how I get my exercise is chasing them around with my spray. I don't know. Is Miles better than that for you? Like he'll sit still?
No.
Oh, yeah, I know. Neither of my kids.
Yeah.
They run and I'm spraying sunscreen. It's getting in my mouth. And
yeah, I hated creams as a child. I don't know why I became a dermatologist then, but
actually,
I absolutely hated having cream put on, and kids do hate it.
Yeah.
They do need a little bit of sunshine. Actually, adults do as well, and that's a good point. When we wear SPF, we don't make vitamin D, and that's really important, and a lot of us are vitamin D deficient. So you do need to spend maybe 10, 15 minutes in the sun, 3-4 times a week without your SPF. Otherwise, you're not going to make vitamin D. And if you've had skin cancer or overexposed to the sun, then it's important you take a vitamin D supplement if you're going to be wearing your SPF every day. Vitamin D is really important, not just for your bones. There's more and more research now coming out showing it's protective for infections, things like COVID or the common cold. It's protective against internal cancer. And there's also evidence that it can protect against autoimmune disease, things like vitiligo, alopecia areata, etc.
And you get vitamin D most absorbed through your stomach, isn't that right?
No, that's completely
your
wrong.
skin.
So, yeah, there are things.
I've heard that, though, from
in
doctors.
Food. No, that you can get foods like oily fish and eggs. Some foods have
from
a
the
little.
sun, though, I mean.
The sun, you absorb it through your skin. Anywhere on your skin.
Okay, gotcha.
So as long as
Are you running around with your belly out?
Yeah.
You could eat a ton of oily fish to get your daily vitamin D requirement.
You can get an easy supplement at, and just, because
over the counter.
I try to give my kids some too, because, sometimes they're not getting enough. And I've been hearing all these studies about this. So it's good to know. This is actually very informative.
That's good stuff.
Yeah.
Dr. Bordet, if people want to get a hold of you at Integra Healthcare, how do they do that?
So you need to phone Integra. I'm still new. I don't know the phone number off the top of my head. You might have to read that off your screen if you've got it somewhere.
I do.
Just to say that my specialty is actually vulval disease. So in the UK, I ran multidisciplinary clinics with gynecologists looking after genital skin problems in women and children. So although I'm a general dermatologist, I see children and adults with all skin conditions, including moles and skin cancer, which we focused on today. I'm a specialist in vulval disease. So that's something that's new to Ireland. As far as I know, there isn't a vulval clinic. It's my dream to establish one day. But if there's any kind of need, which I think we're talking more and more about menopausal problems, and genital conditions are part of that, but also, children with problems down there.
Great conversation, Dr. Bordet.
Please come and see me.
Integra Healthcare, they make it easy to prioritize your health with 2 convenient locations, Grand Pavilion on West Bay Road and Harbor Walk at Grand Harbor, right across from Allura Cafe. And they're open for appointments and walk-ins. For more information, book your visit, call 745-7450, or check them out on the web, integra.ky. Thanks so much.
Thank you for having me.
Nice to meet you.